You hand a sample cup to a nurse and think nothing of it. That routine moment has a very strange history behind it. In medieval Europe, urine was the doctor's single most important diagnostic window. The practice was called uroscopy, and it was deeply systematic. Physicians did not just glance at your sample and guess. They examined color, clarity, smell, sediment, and yes, taste. This was not random superstition. It was a structured system inherited from ancient Greece. Hippocrates had already noted that urine could reveal internal conditions centuries earlier. Galen built on this, linking urine to his theory of four humors inside the body. The humors were blood, phlegm, yellow bile, and black bile. Too much of one humor meant imbalance, and imbalance meant illness. Urine was thought to reflect that internal balance directly. Islamic scholars like Ibn Sina preserved and expanded these ideas during the early medieval period. Their writings were translated into Latin and spread across European medical schools. By the 12th century, uroscopy was a central skill every trained physician was expected to master. The main tool was a clear glass flask called a matula, shaped to resemble the human bladder. Physicians had charts called urine wheels, mapping out 20 or more shades of color. Pale and watery meant one condition, deep orange or red meant another. Cloudiness suggested something was off with digestion or the blood. Black or very dark urine was considered the most dangerous sign of all. Sediment settling at the bottom of the flask told doctors about kidney function. Now here's where things get genuinely interesting and slightly uncomfortable. Tasting urine was not a universal requirement, but some physicians did do it. One taste they were specifically trained to notice was sweetness. Sweet urine was recognized as a sign of a serious wasting illness. We now know that condition is diabetes mellitus, caused by excess glucose spilling into urine. Medieval physicians had no concept of glucose, but their observation was physiologically correct. That is the counterintuitive twist. The method looked absurd, but the result was real. Cloudy urine with a foul smell? That genuinely can signal a bacterial infection. Bacteria increase proteins and white blood cells in urine, which does change its appearance. Modern urinalysis still checks for exactly those same markers. So medieval physicians were not simply guessing. They were observing patterns and drawing inferences. That is exactly what evidence-based reasoning looks like, even without modern instruments. Of course, the system also made serious errors because the underlying theory was wrong. Diagnosing pregnancy, personality, or a patient's sins from urine crossed well beyond the evidence. Some practitioners even diagnosed patients without ever meeting them, reading urine brought by a messenger. Critics within medieval medicine itself called this practice fraudulent. So even then, there was debate about the limits of what urine could actually tell you. The decline of uroscopy accelerated in the 17th century as chemistry entered medicine. Chemical tests could detect things the tongue and eye could never reliably catch. But the core idea that urine is a meaningful window into what is happening inside the body never left. Today, urinalysis tests for glucose, protein, ketones, bacteria, blood, and more. The machine now does in seconds what took a medieval physician careful minutes of sensory examination. Next time a nurse hands you that small plastic cup, you are part of a very long tradition. A tradition built on the simple, persistent idea that the body tells the truth if you know how to listen. Medieval physicians were working with incomplete maps of a territory we still have not fully charted. That is not so different from where medicine stands today. Every generation of physicians is doing their best with the tools and theories available to them. Some of what we confidently believe right now will look just as strange to doctors 5 centuries from today. That is the real lesson uroscopy leaves behind. Not that medieval doctors were foolish, but that science is a process.